Hypomenorrhea. What does a light period really mean, or hypomenorrhea? Have you ever noticed your period arriving lighter or shorter than usual? You're not alone, and chances are it's nothing to worry about. This is what's known as a light period, or in medical terms, hypomenorrhea. While it's often a harmless shift in your cycle, it can sometimes hint at changes in your health or lifestyle. Let's break it down and see what could be behind it. What exactly is a light period? A light period isn't just about having fewer cramps or it usually means shorter duration. Your period lasts less than 2 days lighter flow, instead of the usual flow you might see. Light spotting or minimal bleeding, less blood loss. Typically less than 25 milliliters of blood is lost throughout the period. Everyone's cycle is unique, so a light period for one person might look different for someone else. But if your usual flow suddenly changes it's worth paying attention. Common reasons your period might be lighter: normal hormonal changes. Sometimes your body just does its thing. Hormonal fluctuations, especially as you approach menopause. Perimenopause can make periods lighter, and less frequent hormonal birth control like the pill, an IUD, or an implant can also lead to light or even skipped periods as these methods thin the uterine lining. Stress and lifestyle shifts. Stress doesn't just mess with your mood, it can mess with your cycle too. When stress hormones rise, they can affect the hormones that regulate. Similarly, drastic weight changes or extreme dieting can throw your cycle out of whack. Women who exercise intensely or restrict calories may experience lighter periods or even stop menstruating altogether. Medical conditions. Sometimes a light period may signal something more going on. Thyroid issues. Both an underactive or overactive thyroid can interfere with your period. Polycystic ovary syndrome, PCOS, can cause irregular, infrequent, or light periods. Uterine fibroids, while often linked to heavy bleeding, fibroids can also result in irregular or lighter periods, in some cases breastfeeding. If you're nursing, you may notice your periods are lighter or spaced farther apart. This is completely normal, as breastfeeding suppresses ovulation for many women. When should you see a doctor? A light period isn't usually a cause for concern, but there are times when it's smart to get it checked out. If it's a big change from your normal cycle, if it's accompanied by symptoms like severe pelvic pain, fatigue, or spotting between periods, if it follows a missed period, consider taking a pregnancy test just to be sure. Final thoughts. Every woman's cycle is different, and changes are often just part of life, but listening to your body is key. If your light period is a new development or comes with other symptoms, contact healthcare provider on +254 7011 68 779. Call or WhatsApp. This can help rule out anything more serious and give you peace of